am Dr. Mollie Marti, and welcome to this special edition of Resiliency Matters, pandemic style. Today, I am with two extraordinary women. Dr. Lindsay Malloy is an associate professor of psychology at Ontario Tech University and director of the Development, Context, and Communication Lab. She researches how kids form narratives and memories, including from traumatic or challenging situations, such as the pandemic. She is the mother of two kids. We also are joined by Dr. Amanda Zelechoski, a clinical and forensic psychologist specializing in trauma. Amanda is also an attorney, a professor, and director of the Psychology, Law, and Trauma Lab at Valparaiso University, and the mother of three kiddos. These two Worldmakers are moms, very much like our organization. They're out there sharing their research and their teachings to help everyone get through these struggles. We know the struggles are real. These two women help keep it real, and I'm just thrilled to be with you today. So welcome.
Thank you.
Thank you. Thanks for having us.
Oh, my pleasure. So Lindsay, let's catch any parents before, three psychologists gather and they think, all right, self-care, yeah, and they head out the door. Let's catch them, because I think you have a really great take on, you don't like the term self-care so much either, but you talk about self-care can look like different things. And one thing you say is self-care can look like saying no.
Yeah, so I wrote a blog about this because I was getting quite tired of people telling me that what I needed was more self-care in my life. And I just thought, well, of course I do, but how and how can I make this happen? But I realized I had a really narrow view of what self-care was. And so I started thinking about other ways to engage in self-care. And one of those things was saying no to things. Like we know there's research showing that women are more likely to volunteer for some of those kind of more thankless tasks at work and or be assigned those kinds of tasks. And so just thinking about, what can we say no to, or what can we strategically say yes to? Because, when we say yes to something, when we say, yes to something, we say no to something else. And so just to kind of keep that in mind as a form of self-care.
And you also say it can include asking for what you need, which I think is really important. And I think this might surprise people. It might include lowering your expectations. Talk about that.
Yeah, lowering or managing your expectations. So I think thinking really hard about, like, do I need to take this new project on at work, or do I need to, make these muffins from scratch or whatever? What can I do to make things easier for me? And thinking realistically about what I can handle during this pandemic, whether it's at home or at work, and just being more realistic about the expectations we hold for ourselves. We shouldn't be holding ourselves to the same expectations at work and at home that we had before the pandemic. And I think a lot of us are still doing that.
That's brilliant. So you two hold great webinars on your pandemic parent website. And one of these recently has been with child psychiatrist and author Bruce Perry. And he says this pandemic isn't certainly a sprint. It's not even a marathon. It's a through hike. So Amanda, you wrote about what is a through hike and some analogies to that.
Yeah, it was really great when Dr. Perry shared that sort of metaphor for us, because, Lindsay and I had never heard that term. And I think it sort of baffled our minds that this is a thing that people do. They choose to hike from, say, places like, Mexico to Canada. And so that just sounds like such a journey that involves so much endurance and strength and stamina. And so when he compared what we're going through right now to those through hikes, it was just really helpful to level set, my expectations. And part of the challenge is it's just such a long journey, and you may not know when it's going to end. And there's been so much uncertainty to this whole pandemic process, that we've all been going through, that we don't know when it's going to end. And so the stamina required for that is different than something like a marathon, where what is coming and what those mile markers will be and when you can take breaks and all those kinds of things. So, we did a little research on through hiking, and I was trying to kind of learn some of the language and concepts. So for example, through hikers talk about this notion of cameling up, that, when they can get as much water as they can, they try to do that because they don't know the next time that they're going to have access to a water source on their journey. So they camel up, they soak in as much water as they can. And I just sort of thought about, for myself, there's been ways in the pandemic that I've tried to do that, like because this requires so much endurance and stamina and just emotional reserves to be kind of, managing your family and all of their different needs and your own needs, as Lindsay was just talking about in terms of self-care. There are moments in these days that have been really tough where I could, look up and see my sons actually getting along and doing something really sweetly and playing together. And it's just an amazing moment for me to sort of exhale and see, like, okay, we're still having those moments, even in the midst of all this other stress and tension, maybe disappointment and loss. And so that's how I've been trying to camel up, is to just soak in those moments as much as I possibly can, because they are what are going to sustain me throughout this, because we don't know how long this journey is going to last. We have to take those moments here and there to be able to have that stamina.
And you talk about, their term is trail magic. Look for the trail magic. Another tip you gave in that analogy is take 0 days. And after I read what you wrote, I took a half a day, I claimed it. But talk about that just a bit.
Good for you. I'm so glad you did. And I think for a lot of the reasons that you both were just talking about, women especially tend to not do that, to not give themselves that break or that moment to sort of regroup. And so through hikers take 0 days, and they call them 0 days because they're not going to log any miles that day. So it's just chalk it up as a 0 day. I'm not going to make any progress on my journey. And that's okay, because I need that day to rest, regroup, sort of maybe reevaluate my supplies or what I might need to continue my journey. But it's taking a 0 day without any guilt, that I'm actually planning in my journey, anticipating that I'm going to need these 0 days to be able to rejuvenate. And that is actually what's going to then sustain me to keep going. So I think we really need to take 0 days, and some people will call them, mental health days or self-care days, or however you want to think about them. But giving yourself that permission and grace to just, I'm not going to accomplish anything on my to-do list today. And if all I do is snuggle up with my kids and we watch movies all day, or I need to just take some time for myself, take a little bit of a break, then maybe that's what I need to do. And in the pandemic, that's been hard, right? But sometimes for me, it's been maybe like I just go sit in my car and listen to an audiobook in the garage for like a half hour, because I just need, maybe I can't do a whole 0 day, but I might be able to do a 0 hour, just to not be needed for a little while at work or at home. So I really encourage parents to take those 0 days where you can, or 0 minutes, or 0 hours, and to not feel guilt about it, because it is actually what's going to help you continue on this journey.
I think we're onto something there. The new 0 hour is the new power hour.
There you
right,
go.
for the pandemic. So get that out there. It's where we are. And our work came together, and we will be putting websites up for our viewers. But our Worldmaker International, our nonprofit, released a pandemic parenting program that is available for free right now for viewers. And that's at worldmakerinternational.org/pandemic parenting. You two have come together and created a pandemic parenting organization, and that's at pandemic-parenting.org. I have that right?
Parent.
Is it pandemic-parent, .org, and we'll put that up. And that's where I'm pulling a lot of this just good stuff you write, you do webinars, you're resourcing. So when we went to do our pandemic parenting program, we surveyed nearly 600 local parents, and rising to the top of their concern was screen time during the pandemic. They have concerns, their kids are in front of the screen too much. Should they be concerned? How do they manage it? Lindsay, what do you have to say about that?
Well, and we've seen the same thing in our research and in our webinars that parents are really concerned about screen time. And I think we did a whole webinar on screen time, and we had some of the North America's biggest experts in that area, and so parents can check that out. But I think some key bits from that were, first of all, we have to cut ourselves some slack, because this is an unprecedented situation. This is, these are not normal circumstances, normal times. So again, we can't be holding ourselves to the same standards as we were before the pandemic. And to also think about not just quantity, but quality, right? So the research shows that the quality of the screen time matters quite a bit. It's not just an amount of hours or, minutes in front of a screen, there seems to be this sense too that screen time is this inherently bad thing, and we always focus on the negatives of it. And there are a lot of positives with screen time, and I don't mean just for parents who might need a break, but for kids, for connections, especially when we're social distancing. So it's not the same thing, right, to FaceTime with grandparents as it is to watch cartoons, let's say. So we do have to think about quality versus quantity. And even with just watching a program, though, there's opportunities to create connections. And that's something that one of our guests really emphasized. They don't have to be long connections. I mean, it's great if you can sit down and watch a movie together as a family. I mean, that's quality time, right? It involves a screen, but it's quality family time connecting. But you can also connect briefly with your kids. Like if you're making dinner, walk in the room like, oh, what's this character up to? And oh, this looks really funny. Are you enjoying this? You can have those moments of connection during it. And so it's not just as passive as a child, sitting there watching it on their own. So that's just little things that can be done to make it a little more interactive.
Those are great tips.
Can I just add one thing to that?
Please.
I just was sort of thinking about
Definitely.
For older kids too, like exactly like you were saying, Lindsay, when you're finding these little ways to connect. And sometimes we've heard from a lot of parents who are worried about, their teenagers and their amount of screen time. And it's hard for parents to sort of have a sense always of what their kids are doing. But I found with, just adolescents of different ages, they really enjoy teaching you if you give them opportunities to. And so there are ways, even with my older nieces and nephews, that I will intentionally mess it up and just like, oh, is that so-and-so guy? And I'll say the name wrong. And they're like, oh, no, his name is, such and such. And it's just this opportunity for us to engage about it. And I can kind of play the, old adult who doesn't know anything that the cool kids are doing. And it gives them an opportunity to bring me into the fold and say, well, let me tell you about this program. And here's why this guy's really cool. And so I think just finding those little ways to kind of, connect around what it is that they're doing.
Mm-hmm.
That is such a great point. And I think if parents understand the basic needs and keep their eye on the prize, so to speak, really going back to what do our kids need, right? They need to feel safe.
Mm-hmm.
They need to feel connected, what you're talking about, even within the screen time. They need to feel that sense of competence. So you just fed that with your example. Teach me, or, oh, I made this mistake. I need you to be my teacher, right? And then that sense of meaning making. And we're going to talk more about that meaning making when we come back and talk about grief, because we have lost a lot and things are changing. So we're going to talk about grief and meaning making and more when we come back.
Today, more than ever, you need fast, reliable internet. At MediaCom, we want you to know you can count on us. Our fiber-powered 100% gigabit technology network was built for the future. We have enormous capacity and power and 99.99% network reliability. So even though these are uncertain times, we're prepared, and you can be certain we'll keep your world connected.
As the nation's doctor, I often get asked, what should I do if I think I might have coronavirus?
People who are sick should stay home. You don't go to an emergency room, you don't go to a clinic. You get on the phone and you ask for advice and instructions from your physician.
We don't want you to go into the ER or the doctor's office without talking to them first, because you might spread coronavirus to someone else. Please visit coronavirus.gov for more information.
Thank you for virtual family dinners and long-distance birthday wishes. Thank you for sweet streaming melodies and spontaneous dance parties. Thank you for keeping classrooms together and learning alive. Thank you to our incredible network of employees who make all these beautiful connections possible.
Hi, I'm Dr. Mollie Marti, and welcome back to Resiliency Matters. Today, we are talking with the pandemic parenting moms, Amanda and Lindsay. And Amanda, we left talking about grief because we have lost so much since COVID arrived. Talk about the importance of recognizing and honoring and giving ourselves some space for that grief.
Yeah, people tend to think about grief as being mostly related to the loss of a loved one, the death of somebody or passing of somebody. And I think one of the things we've really tried to emphasize in some of the resources we've put together is, what grief is and how it can relate to many different areas of your life. There have been so many losses throughout the pandemic. And a lot of parents that we've talked with have felt sort of bad or guilty about, I know it's silly for me to be sad about my daughter's prom being canceled or graduation because I know other people are struggling with, things that are much worse. And we've tried to sort of tell them to, pause that thinking, because actually it's really important for you to, work through that grief, acknowledge the loss. That was something that was really important to you. And so it's okay to feel that. It's okay to recognize how sad you are about that, or your kids and their grief. And that's actually really important, is to acknowledge and validate their feelings of loss around things that you might not realize was really important to them, or it might seem sort of, silly, or I didn't realize that was that big of a deal. But that sense of loss is important to acknowledge and honor, because it's the way we move through it. And it's also teaching our kids, various aspects of resilience, and that we're going to continue facing different kinds of losses in our lives. And so this is a great opportunity to kind of model what healthy coping with grief looks like. Again, acknowledging, naming it, recognizing like it's okay to feel sad, and other days it's okay to feel all right about it too. Both of those things can be possible, that I feel really sad about this aspect of it, but I'm looking forward to this other thing that we can do next year instead. And so we really encourage you to recognize, name the things that you've lost and that you're grieving, and know that it is okay to feel sadness and disappointment about those things, and that your family might be grieving very different things or on very different schedules.
Great tips. So Lindsay, and I'm just thinking of my daughter's missed graduation, right? We've missed those things and celebrations, and we've had some holidays behind us. We're stepping into another holiday season. And what tips do you have for parents on managing expectations and behaviors through the holidays?
Yes, and I think parents are feeling really stressed about the holidays this year because we've had so few opportunities for celebrations. And so there's a lot of pressure. And I think on moms in particular, because we tend to kind of do a lot of the management and orchestration of these types of holidays. So I think one thing I would say is, prepare your kids in advance, or your other family members for that matter, about what they might expect during the holidays. So, if you know that things are going to look very different, and they probably will for all of us, then, let them know to the extent that you can what the holidays are going to look like, so that they can be prepared. Research, on children's experiences, very stressful experiences, traumatic experiences like, medical surgeries and hospitalizations show that, children do much better when they're prepared in advance. And so, talk to them about it. Talk about what it might look like. Set up ground rules with, what's going to happen, or is there hugging going to be involved? Just so that kids, especially those who are prone to anxiety, can have that sort of ground rules in advance. So I think that's really important. When you're having these conversations, though, I think it's important not to, necessarily assume that your kids are going to be very disappointed about the holidays, because there are things that as an adult, you probably have a very, inflexible script of exactly what the holidays are supposed to look like. And so you might be very disappointed about some of the changes, but kids, are often more adaptable, and they might just kind of roll with certain things that you find upsetting as an adult, like visiting Santa outside with masks on or something like that. So I think, allow them to feel disappointed, allow them to express that, but don't set up this terrible vibe of like, the holidays are going to be awful this year because we can't do this, we can't do that. Focus on what you can do as well as maybe what you're not able to do. And maybe even, what you can do this year that you couldn't do before because, you were traveling, or, those sorts of things. I think the last thing would be to think, coming back to those core needs that our kids have, and think about the why behind the holiday traditions and celebrations. So if there are things that are stressing you out, that are not really serving your family right now, certain holiday traditions that you might have had, then don't do them if they're causing more stress. So think about, is this helping my children feel, secure, safe, loved? Is this fun for us, or is this an added stressor? And if it's just a stressor, then, by all means, maybe, drop it this year and try something else. So just keep coming back to the why underlying, why are we doing these traditions? If we're trying to create positive memories, is that working? And if not, let's try something else.
Yeah, my kids are so excited to be able to pick what we're having for our holiday dinners, because usually, we'd be going to relatives' houses. And so exactly like you said, focus on what you can do. They're ecstatic. They're like, great, now we don't have to eat that stuff we don't like. And, the grown-up food, because I've let them each pick, like, what do you want to have for Christmas dinner? And they are just tickled pink by that. So it is fun to think about what can we do, like you said, instead of, what we're not able to do.
And empowering them to make those decisions, right? Giving them back that sense of control and predictability that they have really been lacking. We let our kids pick the Christmas decorations for the front yard. And so that was like a little bit of control, and, they were very excited about that. So I think that's great.
Really fun. I'm thinking mac and cheese might be present.
How did you guess?
just a guess.
Chicken nuggets.
Spot on.
Ice cream for dessert. Okay.
Right.
So talking about this stress, Amanda, I mean, we are hearing from parents like, why am I struggling to just get through the day? I used to be able to do this or that. And a decision I could just make. Now it just feels like it takes 2 hours just to make a simple decision. Share what's going on with this cognitive load or decision fatigue. I think
there is a lot going on. I mean, that's exactly, you're spot on. The fact that there is so much going on, and that's why we're so exhausted by this. So if you think about, since the pandemic began, from a sort of even minute to minute, hour to hour basis, how many decisions you are having to make. Now, as parents, we have to make a lot of decisions anyway. But now these decisions started to be about the safety of our family and major decisions around things like, am I sending my kids to school or not? Is it safe for us to go here or not? How do I ensure our safety? How do I can't control other people's behavior. So what do I do with my family? I mean, those are the kinds of decisions then we were being asked to make. And sometimes it felt for me like on an hourly basis. And those are big decisions. And so when it then came to at points in your day where you feel like, why can't I just decide what we're having for dinner? Like, I feel trapped by this. I'm struggling to kind of make this decision. What's wrong with me? It's because you're having this decision fatigue. It is this, you're overwhelmed by so many things going on, not just around safety, but maybe it's also like I'm having to make decisions about what to prioritize in my work because I only have this block of time when I'm not, helping my kids with their remote learning. And so I'm triaging constantly. That is exhausting. And we weren't built to sort of sustain that in the long term. You're kind of in crisis mode for this extended period of time. And so because of that, you are probably experiencing this decision fatigue. And so I think it's just important to understand that many people are feeling this. And in fact, some of the research is showing we're struggling with it more now, 6 to 9 months in, than maybe we even were in the beginning. And it's because we're just exhausted. There's been so much of this decision making we've had to do all along the way. And so when you kind of think about that, it's very overwhelming to try to make big decisions and long-term decisions all at once. And so what we've really been encouraging parents to do is to, maybe you, like in your house, like mine, have been watching Disney movies. For us, it's been Frozen 2 on repeat. And so we're asking you to channel your inner Anna. She sings a song in Frozen 2 where she talks about just doing the next right thing. So to try to adjust your decision making from making these big decisions or decisions that feel really big to what's the next thing I have to do right now? What do my kids need for their assignment right now? What do I need to do for work? What do we need to do to kind of get through the next hour? So to chunk your decisions into smaller steps so it doesn't feel so big and overwhelming. And the other piece of that I would just say is to also not feel like decisions are forever. There are very few decisions that are permanent and unchangeable. So do things until they don't work anymore. So this decision that I made, it works until it doesn't. And just reminding yourself that, so fine, if this doesn't work 2 weeks from now and the way we decided to do it, we'll readjust, we'll recalibrate what we need to do. So that way decisions don't feel so big and overwhelming. So just keep trying to do the next right thing and then just do things and they work until they don't. And then you readjust.
And you guys have a great 7 tips for better decision making during this time on your website at pandemic-parents.org. And that is a really useful tool for parents. So I encourage our viewers to check that out. So Lindsay, you use a Zoom metaphor because another thing we need to do, Amanda talked about, there are very good people who hold very different opinions about what is the best way forward. And so connection is incredibly important, and so are healthy boundaries. Talk a bit about your Zoom metaphor, something we didn't even know, what Zoom was, many of us earlier this year, and now here we are. Share that.
Here we are, having had far too many Zoom meetings. And I think that's, when I was thinking about how to manage family conflict and the Zoom metaphor kind of came to me, it was definitely after a few too many meetings. And so I started thinking, sort of fantasizing about what if we could mute people in real life? Wouldn't that be amazing? And so that's kind of how that came about. But yeah, so I was thinking, first of all, it doesn't have to just apply to the holidays, just managing family conflict in general. I think that healthy boundaries can be so hard to set. I know I struggle with this a lot, and especially with family members or loved ones. And around the holidays, this can be kind of a minefield for a lot of us who struggle to set those healthy boundaries. And so just thinking, okay, turn your microphone on. That's the, thing that even after months, we're still saying, you're muted, you're muted, you're muted. So just turn your microphone on. And this is not the year to kind of do things you're not comfortable with to please other people or because you feel guilty, right? This is the year to definitely set those healthy boundaries. And to make sure people know where you stand and to have ground rules set up in advance. Like, let's say you are doing a gathering and you feel like, oh, I only am comfortable doing gatherings outside in these kinds of circumstances. And then have something, a phrase or a sentence or something you can say in the moment if people start breaking the rules so that you're not caught off guard, right? So you don't get flustered when you're trying to turn your microphone on and set those boundaries. And then also, you can mute others as you need to. You can, set those healthy boundaries. You can do it in a kind but firm way, but you can't control how other people react to them. So, you can be as gentle and as kind as possible, but, at the end of the day, those are your boundaries. And if others react poorly to them, you may have to just learn to be okay with that, right? And to kind of mute those voices. Those would be the two biggest ones, I think.
That's really helpful. And I'm going to wrap up here, Amanda, by quoting something you wrote. And like I said, I just enjoy both of your writing. But you talk about give yourself the audacity to hope. And I would like to leave our parents with that hope isn't just a soft emotion. It is a thought process, and it's supported by setting, that path and taking it step by step, and then getting support, asking for help, all of these things that you're resourcing parents. So I thank you for all the work you're doing at Pandemic Parents, your organization. And again, I invite viewers to come to worldmakerinternational.org/pandemic parenting to get a free 10 module, less than 20 minutes each, to just keep stepping forward. So viewers, thank you for joining us on MediaCom NC22, your local programming leader. Thank you, Amanda and Lindsay. You all take good care. Remember, we thrive together.